table work research, the continuation of our course research 101. So what we'll be talking today will be the table work research. We'll talk about introduction, plagiarism, ethics, structuring paperwork, proposal, and literature review, and the past few classes we've had. So today we'll be going a bit in depth into table work research, um, because basically what we've been talking about the past few classes were focused on research, peer review, paper writing, but today we'll be talking about the act of doing the work in the lab, hands-on and all. So today's topic content will be introduction and grouping, dosage administration, and table work. And I'll be making reference to the research work I did during my undergrad. The process of conducting a laboratory experiment is an act of getting to, if not an actual result, to a hypothesis. So in summary, what this is trying to say is instead of getting people's research work to get a conclusion. In this instance, you get people's research work to get an understanding on how the research work is ought to be done. And then you go ahead and do your research work from scratch, um, the whole process and everything, and then um, extract or get the result out in order to analyze it and get an answer instead of using other people's results to get a conclusive answer. So types of non-literature review research um, that we have the questionnaires, the laboratory form, the interview. Now the questionnaire is basically simple as the name implies. You get a question format and stuff, and then you give it to people and get people's opinion from those questions, and then you analyze those the answer to those questionnaires in order to get an answer to the hypothesis. While laboratory the laboratory type is the one whereby you go to a lab, you use some specimen to run your research work, or you use things like the Wista rats to do your experiment. For example, when I did my research work, I used Wista rats. I used Wista rats whereby I had to wear them for a certain period of time, and I had to group them, which is something we're going to talk about later on. And I had to administer my extract, which was the drug dosage, which I used. So the laboratory is basically hands-on, whereby you do the experiment in the lab in order to answer certain questions. A good example was my research work on, as I have said previously, was the effect of Passa americana, which is avocado, which I believe most of us know, on Wistarat, male Wistarat, to check how effective it is in the reproductive system of in the male reproductive system and all. And after I was done with the administration, that's the dosage and everything, I have to take the hormone level, the enzyme level. I have to check the testicle of the subject, that's the Wistarak I used, in order to check the effect of the Fata Americana, that is the avocado I used within the certain period of time. And another thinking with laboratories, especially making reference to the research work I did, was that you have to understand the physiology and anatomy of the the experiment you are doing. For instance, I use this rat, and if I remember well, the time for spermatogenesis in with rat was I think about 179 days. So my research work spanned within that period of time in order for me to be sure that yes, I was able to get, if not interviews and that form of non-literal review research format, whereby you go and ask for questions verbally and then you document the answer to those questions in order for it to answer whatever hypothesis for your research work you're working on. In case anyone has any question, you can just ask it in the chat box, then I'll try to address that as quickly as possible. So now grouping in non-literature review research work is basically being able to categorize what you are doing in order to get an accurate result. For example, if um, you are doing more of a lab research work and you are making use of certain medication or certain extract from certain plants, one of the standardized or the best formats to use is basically having your dosage in the middle, whereby you have your placebo and then your standardized drug. Now, what placebo means for those of us who don't know is basically um, giving something that has no medicinal effects. For instance, giving some water. Some people think water has its own medicinal effect. They're giving something that is part of your daily life, but has no medicinal effect, so to say. That's the placebo, which is usually grouped in the first stage, and then you have your standardized drug, which is the last stage. So typically, how I do advise students and people to do laboratory grouping is basically your group one is your placebo. So you're basically not giving them anything. You can just not give them anything at all. Then the fourth group, if you are doing a two dosage grouping. So the fourth group will be your standardized drug. And what standardized drug means is, for instance, what is the medication that has been given to people for the past few years in relation to the topic they're addressing. Now, the topic I addressed at the time was male reproductive system. So at the time, vitamin E helped, quote and unquote, I mean, vitamin E helped the male reproductive system at the time, helping fertilize in good stem cycles, spermatogenesis, helping reproduction. Um, then in between that, I had my extra, which was the plant or the um, um, crop that I was using for my experiment, which was avocado. The extract to be specific, because I had to go through laboratory process to extract what I wanted from the avocado. So outside the placebo and the standardized drug, the extract was my group B and group C. So please, in case anyone has any question or you're not really understanding the concept I'm explaining, please just ask it so that I'll clarify. The group, my group B at the time and group C was the avocado extract, which had two dosage. Now the thing about dosage, after you have done your grouping, which is a group one, two, three, four, group A, B, C, D, which one of the first group is the placebo. You're not giving them anything for your experiment, so that I can make reference to that. Then your group four, which is your standardized drug, which is something that has been used previously and has worked. Then the medication, the dosage, or the plant that you want to experiment. Okay. Are you hearing me now? I don't know if I'm speaking loud enough. So yes, so after you've done your grouping, the next thing is, okay, what's the dosage, or the scenario situation, um, that will fit into your experimental aspect. So we can replace the dosage if you're not using medication to a situation. Okay, when I mean situation, for instance, maybe you want to create, okay, how do students react to studying with their phone? So that probably will be your first experimental dosage then. how do students react to when studying with their phone and their laptop, something like that. Um, but in this instance, I'm using dosage. So your first group is a placebo, then your last group will be your standard dosage. So the one that comes in between your placebo and your standard dosage is basically going to be what you are trying to experiment, what's your hypothesis. Now, remember, this is not a review research work, this is a table research work. The difference between these two, just to clarify, review research work, that's literary research work. You basically get people's paperwork and then analyze it and review it and get a conclusive answer from those previous research work that have been done. That in a table research work, you're basically doing the research work yourself, basically hands-on research work. So that's when the classification comes in the grouping. So the group one is the placebo. If you are giving the subject or the experimental group nothing, then your last group is your standardized dosage. So basically, the standardized dosage is this what has been used previously in the medical world that has helped or not fully or totally helped, but it's something that has been recognized as a go-to anticipation scenario or medication for that question you're trying to answer. Then, in between your placebo and your standardized drug is what 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 is your hypothesized solution? So, what are you trying to bring in to the equation that you feel or suspect based on other research work that it could help. So that's your experimental dosage and your second experimental dosage. So going going back to my research work as a reference, I did exactly this way. I had my placebo, my standardized dosage, and I had my first experimental dosage, my second experimental dosage. So my first experimental dosage at the time, which was the avocado, was about 150 milligram weight of the Wistarad. So how that works was for every week there's a certain dosage you give. For I don't know if any of us have done pediatrics yet. There's for you to give medication, even in adult medicine, you have to give it per the body mass or the person's body weight. So that's the first experiment. So the second one was a multiplication of the first dosage, which was 300. So the first dosage was 150 milligram per DL, then the second dosage was 300 milligram per DL. So that's how you do your dosage administration after the cooking. It might be medication, might be a situation or a scenario you're trying to recreate in order to answer your hypothesis. Now, the table work basically involves collection and extracting the data or needed aspects of the research undergone to analyze to be able to analyze it. So if you are doing a questionnaire research work, you get all the data you need, either in groups or randomized data collection, and then you analyze it. Then for the questionnaire and for the interview aspect, you ask people and then you take note of the answers of those questions in order to analyze it. And then for laboratory research work is basically like for my own research that I did, after I did the whole routine dosage administration for about 197 days or so. That's the stomatogenesis life cycle of Vista. I identified the Vista to the lab, extracted the blood in order to analyze the hormone, that's the FSH and LPH, analyze the enzyme. At the enzyme I was analyzing at the time was PCP. I think I was prostate cancer enzyme to see if the medication in any way or form of shape affected that enzyme or led to prostate cancer or helped reducing the possibility of prostate cancer in Wistarad. And then I did histological analysis of the testes in order to see if there was any morphological change or anything at the time. So that's the laboratory aspect of research work. It's a lot of hands-on compared to literature review research work, where basically just deal with reviewing other people's paperwork or research work in order to come to an answer. and stuff. So yes, basically, table research work involves collecting and extracting the data needed aspects of the research undergone to analyze it. So in summary, what we we've talked about today is the difference, understanding the difference between review literature review papers, such as the ones we've been talking about and the ones you are very much accustomed to, and actually doing a table work, research work, which deals with hands-on, deals with actually dealing with dosage, grouping, categorizing, or doing the randomized data collection, the types of um, um, table work research we have. There's the interview aspect, the laboratory aspect, the questionnaire aspect. Um, Someone wants to ask a question. Samuel? Okay. Yeah, Samuel, you want to ask a question? Okay. So I don't know if Samuel is hearing me because you raised your hand. So I just want to know if you have any questions you want to ask. Okay, so basically, that's the topic for today, being able to differentiate literature review research type of work and non-literature review type of work. And one thing with the non-literature review type of work is basically knowing and understanding how to do your grouping and then how to do your dosage administration if you find yourself in, in any situation whereby you want to do a non-review literature type of research work. So, anyone have any question? So basically, that's all for. Okay, yeah.
Oh no, I don't have any question for now.
Okay.
I would need to go through the video again, the lecture again. It's raining heavily where I am right now, so it's difficult for me to, like, I was really straining my ears to hear. So, but I will need to go through the class again, and then I can ask my questions afterwards.
Okay. Okay.
But
That's
now,
good.
no.
Okay. And since you
Thank
guys have my email and then the Google Classroom, just in case, just send the question there, or you can send the question in the group chat. I'll be available and willing to clarify and answer that for you guys. So it's quite a short lesson today, and I also apologize for not having a class for a while. Just so many things going on. But yes, in case anyone has any question with the outline, any topic within the outline, whether we've touched the topic or not, you can take a question or ask whatever you need clarify that for you. Then, yeah, I'll be willing to take you guys along. Thanks for you guys coming on today. I really appreciate the time. We'll have the next class by God's grace next week. So thank you.
you very much. Thank you.